Welcome to another program of Focus on Health. I always do a teaser now, so this is the teaser. For all of you who've watched this program for a long time, I've only done this type of a program once. I've only done this type of a program one time. So when we come back from the end of the commercial, we'll see if you've been right. Bye-bye.
Get up and get groovy.
Kid, what's up with you? Let's get up and play. Do something. Stop slumping like a lump all day. Get on up, come on. Get out the door. Let's shake that booty like never before. Let's run, have fun. Let's jump and groove. Get up and get that body up. Make it move.
Get up, and be a player. Get up.
Woo. Let's run, have fun. Get up and be a player.
Get up and play an hour a day.
Ouch! Sorry. For cool playtime ideas, go online. Just don't stay long.
Am I pretty enough to be noticed? Will they love me if I go on a diet?
Why do girls need to be skinny?
Will my freckles go away?
Do I need liposuction? Do I need a boob job?
Do you think I'm fat?
Do you think I'm fat? Do you think I'm fat?
Another program of Focus on Health. This program is only geared to do two things: to give you enough health information that you can choose a healthy lifestyle, and secondly, if necessary, make wise and informed healthcare decisions. To my right, I have Mr. Kevin Gardenhire here. And to answer your question, I've only done one show like this here. I've only done one hospice show. And Mr. Gardenhire here is for Glory Hospice and Palliative Care. And Kevin, glad to have you.
Glad to be here.
Kevin, I like that shirt. Don't lay that shirt down now. I kind of like that.
Well, I have to keep with the blue and the yellow concept of Glory Hospice.
I see, boy, you're advertising. I'd like for you to look into that camera right there and just tell our viewing audiences something about you and where Glory Hospice is located. But just start out with something about yourself. Take about a couple of seconds.
Okay.
Right there.
My name is Kevin Gardenhire. I'm the CEO of Glory Hospice and Palliative Care. We are located at 122 Enterprise Court, Suite D in Columbus, Georgia. Our telephone number is 706-507-5445, and our website is www.gloryhpc.com. We have been in Columbus for about 5 years now. We are a Medicaid, Medicare certified hospice. Our goal is to be an additional hospice provider to the community. We're a Christian and minority-owned hospice. We value hospice, and we look at hospice as a ministry versus just a company. I will say it takes a very unique person to work for Glory Hospice. We look for people who not only want a job, but who really have the compassion and really want to help people in their time of need.
Boy, Kevin, I'm telling you, that is good. I like that, boy. That is really good. So I can't wait to have everybody, Ben, you gave all that. I can't wait until we get started and start talking about Glory Hospice. Let's get started. Tell me a little bit about Glory Hospice.
We've been here. I'll tell you how, actually, a lot of people always ask me, how did you end up in Columbus? My wife had went to, at the time, she was working for another home health agency up in Atlanta, and she went to a meeting for hospice investors. And she came back home, and I can just see the fire in her eyes. And, you know, she was like, this is something I want to do. And at the time, I was working for Bank of America. She came home, and, you know, I kind of said, well, honey, we'll see. We'll see. That turned, I mean, God just moved in so many different directions. The next thing I know, we had prayed. I said, well, let's pray. I said, well, what do you want to open the hospice up? You know, and so we prayed. And I tell you, when the Lord spoke and said, Columbus, Georgia, I said, Lord, you got to be kidding. That's 2.5 hours away from where we live. And at the time, I didn't know anybody in Columbus. The only thing I knew about Columbus was Fort Benning. Being in the Army for 10 years, I knew about Fort Benning. And I'll tell you, we stepped out on faith. I remember the first time I drove down to Columbus, I had a map. And you know, didn't have the GPS because I really didn't know where I was going. Right. And was looking for office space. Our first office was on Hilton Avenue, little one room office. And you know, at the time, because we were so new, we couldn't afford to really pay staff full time. So you know, God just led us to people who said, you know what, I still have my full-time job, but I'm going to help help you guys
that's
get open.
awesome. And that was the beginning.
And that was the beginning.
Let's get with your mission statement. First slide, please. All right, that mission statement says what? To always put our patients and families first, strive to make every contact with your loved one a meaningful experience.
We take every opportunity that we come in. You know, hospice is such a unique situation. Even with the color of our uniforms, our nurses wear bright yellow.
Good.
And that's because when we walk into an environment, we really want the light of Christ to just
There we
elevate
go.
and magnify
There
when
we
we
go.
come in the room. So our mission is focused is that contact, that first initial contact, to be a bright, positive experience, and maybe, you know, and not in such a good situation for
Sure.
a patient or a family.
Let's talk that vision statement.
To ensure this time in one's life is met with compassion, care, and dignity. We affirm life and treat dying as a special, unique part of the life process. We are passionate about providing quality care in a manner that is thoughtful, meaningful, and truly makes a difference in the lives of those we serve. Our gentle and knowledgeable staff is passionate about delivering the best quality of life to each patient.
I like that.
That's what my company, we stand firm on this mission and vision statement. It's posted when you walk into our building. It's the first thing you see when you walk through the doors.
I'll tell you what I do like. You can go to the next slide, please. I like what GLORY stands for. GLORY stands for what? Giving.
Giving the best at all times in every situation. The L, having the courage to provide leadership while shaping the future. The O, choose every opportunity to make a difference. The R, respect self and others while maintaining a positive environment for teamwork and growth. And the Y, remembering yesterday, capturing today, and looking forward to tomorrow.
And that Psalm.
And our scripture the scripture where we base Glory Hospice and Palliative Care is Psalm 57:5. Be exalted, O God, above the heavens. Let your glory be all over the earth.
That's powerful.
That's our scripture reference. It's on everything we have. It's the backbone of why Glory Hospice and Palliative Care exists.
And that's really what got my attention when we sat down in my office. It's Christian-based, and what really caught my eye, though, was the glory. I mean that stuck out, and of course the Psalm stuck out as well. How many counties do you serve? Next slide, please.
We service 10 counties, Muskogee, Harris, Taylor, Talbot, Marion, Troup, Stewart, Webster, Chattahoochee, and Meriwether.
Boy, that's a lot of windshield time for people that work for you, isn't it? That many counties.
It is, and we use a strategic approach because we definitely want to reach the populations not only in Muskogee but the surrounding counties. So what we kind of do is we basically divide our area up into a grid, and wherever the patients, and that's our mission is if we're going to touch every patient, we have to go into those rural areas where
That's exactly right.
They may have one doctor in the whole county, but to be able to
And
provide
you and I
care.
both know that things are really slim in the counties.
Yes.
I mean, the counties are in need of not only health care, but they're in need of hospice. And so, we really need to reach out to the counties. And I'm really glad to see that you're reaching out to as many counties as you are. Next slide, please. Let's talk about hospice now. A lot of people have a big misconception about hospice. So let's go through this here quickly.
One thing, whenever people ask me, hospice, hospice has been given a bad name, because most of the time when people address hospice, they think of it as a death sentence.
Not only that, but they think of giving up on loved ones.
That's not the case. Hospice, the concept of hospice actually came from the medieval times. It would symbolize a place where the travelers, the pilgrims, and the sick, and the wounded or dying would come to find rest and comfort. Hospice offers a comprehensive program of care to patients and families facing a life-threatening illness. Hospice is primary concept of care, not a specific place of care.
And now that's one thing that I try to stress into the community, because a lot of people feel that hospice is a location, and it's not. Hospice comes to you.
Exactly.
And that's the uniqueness of hospice care, that they do come into the person's home, an environment where the patient wants to stay, where the patient feels comfortable. And if need be, then the patient will go to. But the bottom line is the fact that hospice care is focused on the patient. And another thing that in our conversation that came out, that I'd like to clarify with our viewing audience, is that when it comes to hospice care, that patient is in control.
Absolutely.
The family members are in control.
Absolutely.
And that's something that I know you probably, some of the obstacles in the community, they think that they're giving up. That patient and the family care providers are in control.
Absolutely. I had the unique opportunity to actually, when my grandfather, they wanted to put him on hospice, and my grandparents have been married 63 years. And my grandmother, when they spoke of hospice, my grandmother said, I'm not giving up. I'm not giving up. And it came down to the point where I had to explain to her, you're not giving up. But at the same time, my grandfather, you know, he was the pillar of our family. He was the cornerstone of our family. He earned that respect and that dignity. And, you know, and I just had to basically explain to my families that you're not equipped to take care of him the way he needs to be.
And that's the second biggest thing, is that individuals need to know that there are competent personnel that can take better care.
Absolutely.
You know, who are trained, who are educated, and who are at the same time very caring for each and every individual. So let's maybe go to the next one. Hospice emphasizes palliative rather than curative treatment, quality rather than quantity of life. And hospice provides personalized services and a caring community so that patients and families can attain the necessary preparation for a death that is satisfactory to them. And that the patient and family are both included in the care plan, which is what we just talked about, and very, very, very important, that the patient and family are both included in the care plan, and emotional, spiritual, and practical support is given based on the patient's wishes and family's needs. And that is, of everything, one of the most important and comforting thing that I've tried to relay to the community, that hospice does do that. They're family focused, and they're focused on what the family wants.
Absolutely.
Let's go to the next slide, please. Okay, who should be receiving services?
Hospice is actually, it can be discussed at any time. Often the discussion about hospice services take place when the patient and his or her loved one learns that the disease is no longer treatable and that additional therapies will not provide any benefit. Life expectancy may be 6 months or less. A physical decline and exhaustion are likely to be permanent. And then finally, when the patient no longer desires treatment.
Right.
And that's key. You know, a lot of the patients, some of our patients, I'll just talking in general about our patients, a lot of them have already made their peace.
Sure.
All they want to do is go be with the Lord.
Right.
And it's hard for the family at times to let go.
To let go. I'm glad you brought that up, Kevin, because oftentimes the patient has accepted the reality of the situation, and it's the family member. So one of the most important things to our viewing audience is the fact that the reason I'm so high on hospice care is that the individuals realize the situations that the families are going through. And oftentimes, as you correctly said, Kevin, that the patient has accepted the reality of the situation. So a lot of the time, you're not only caring for the patient, but you're caring for the family members as well.
Most of the time, it's the family.
Most of the time, it's the family, right? Can we go to the next slide?
Who can benefit from hospice
There
care?
we go.
That's the question that we get asked all the time. Hospice care is for a terminally ill person who is expected to have 6 months or less to live. This doesn't mean that hospice care will be provided for only 6 months.
Right.
Hospice is basically designed if the disease run its normal course.
That's exactly
and
right.
And the expectancy is 6 months.
It's 6 months or less. But as everyone knows, everyone's different.
Everyone's different.
So it may not be, quote unquote, six months. But in estimation of the doctor will definitely emphasize it is a life-limiting situation.
And with medication and equipment today and research, I mean, it's documented fact that people are living longer.
That's exactly right. That's exactly right.
Hospice care is not just for people who have cancer, and you know most people associate cancer with hospice.
Sure.
But hospice, you know, many people receive care that have cancer, while others may have heart disease, dementia, kidney failure, COPD, Alzheimer's, dementia. I mean, all of these
Sure.
are hospice diagnoses.
Diagnoses.
Hospice care has been shown to make people have incurable illness feel better and live longer.
Sure, their quality of life, what you said in the thing, it's the quality of life, so not so much the quantity. At that particular time, it's the quality of life of each and every day for the patient and
the family.
Bingo.
And the family. Enrolling in hospice care early might help you and your loved one develop a strong relationship with the hospice staff who can help with preparation for end-of-life needs.
And you want to know something? I am a big supporter of all types of hospice care because I go out into the community, Kevin, I see so many families who are struggling with loved ones because they had this myth about hospice care. And so this is only my second program. I am going to have you back because I do know that there are other things that are provided. We're going to talk to a super bad to the bone
Super
nurse.
bad.
Huh?
My clinical manager.
Your clinical
Yes.
manager.
Oh, yes.
Your clinical manager that I was very impressed with. And I'll tell you, she's off camera. When I met with him one-on-one, half the conversation was on his clinical manager. I'm telling you, she's bad to the bone and a good one. So we're going to be right back right after this next commercial.
Bicycles are fun at any age. Just remember the rules of the road when you're out enjoying a bike ride. And motorists, when you're sharing the road with cyclists, use caution and give at least 3 feet when passing. Bicycles are safe, fun, and sensible. When you ride, be visible, be predictable, and be alert. You'll have a safe ride and a great time. Let's get there together, Georgia. A message from the Governor's Office of Highway Safety and Georgia Bikes.
I am a teenager.
I am online.
I enjoy sharing thoughts.
Music. Videos.
Ideas. Information.
I will not
be a victim to threats.
to stalking.
To soliciting.
To predators.
I will be responsible.
I will be careful.
I will be honest.
I will be smarter. I would get my parents involved.
I will protect myself.
I will be safe.
I am a teenager.
And I
will not
be bullied.
I was afraid of that.
Well, guess it's time to get you fixed.
Your pets will start fooling around sooner than you think.
Go on, get out of here!
Accidental litters lead to millions killed in shelters each year. Help prevent more. Fix at month.
I present to you Algebra 2. Foreign languages. And finally, biology. Who among you will step up to their challenge?
Me.
Me too.
Take on the tough classes now. You need them to prepare for college.
I volunteer.
I volunteer.
Step up. I volunteer.
I volunteer.
I volunteer.
We volunteer.
And I volunteer.
Hi, I'm Michelle, and we all volunteer for Columbus Animal Control.
If you're interested in volunteering, please call me at 706-225-4666 or email me at animalcontrol@columbusga.org.
Welcome back to Focus on Health. Now, so the clinical manager, bad to the bone, knows everything from nursing through A through Z. Miss Andy Scott right here to my right. Andy, look into that camera right there and let our viewing audience know personally something about you, and then talk about Glory Hospice and give all that information that Kevin gave.
Hello, everyone. My name is Annie Scott. I'm the clinical service manager at Glory Hospice and Palliative Care in Columbus, Georgia. I have been a nurse for 27 years, so I come with an array of experience, anywhere from emergency medicine to ICU, critical care nursing, now to end of life. And when I think of end of life, several words come to meaning to me: support, comfort, dignity, respect. And that's all the accolades that we have at Glory Hospice that we try to portray for our patients. We stand on our mission of putting family and patient first. And that's what we're patient and family-centered. I love nursing. Nursing has always been embedded in me. I guess it's the nature part of us, giving nurturing care. My mother was a nurse, and I just watched her being a nurse, always been my mentor, and nursing has just been a part of me. I love giving back to people. I love the standard of care. I love being there for patients. And that's what Glory Hospice is about giving back to the family members, about loving them and meeting them where they are. And that's what we strive to do, meet patients where they are.
Fantastic. And give them all the information, how they can contact you, phone number, address, and whatever right in that camera.
We're located at 122 Enterprise Court, Suite D as in David, Columbus, Georgia. Our phone number is 706-507-5445, and our website is www.gloryhpc, that's henrypaulcarl.com.
Boy, I'm telling you, you got that bad boy together. I tell you, push it back to the boat. I mean, she has all that stuff. Okay, let's talk about, and I'm asked this all the time, which diagnoses are covered under hospice care?
Well, there's an array of diagnoses that can be covered, such as cancer, ALS, dementia, heart disease, lung disease, stroke, HIV, any type illness that's terminal, that's irreversible.
Good, that was easy enough. Can we go to the next slide? Where is hospice care provided?
Most hospice care is provided at home with a family member typically serving as the primary caregiver. However, hospice care is also available at hospitals, nursing homes, assisted living facilities, and dedicated hospice facilities. The majority of patient care is provided in the place the patient calls home.
So in other words, wherever the patient is comfortable and satisfied, that's where you provide care.
Yes, sir.
And that's a point that I was trying to, that Kevin and I both brought up, is that I hear out in the community so many times, two things. They don't want to give up on their loved ones, and secondly, they don't want their patients to leave home. The emphasis with hospice care is providing care to the patient where the patient feels comfortable.
Absolutely. They can die in the dignity of their home around loved ones.
Would you repeat that again?
They can die in their home in the dignity around loved ones.
That is extremely important. Okay, next slide, please. Now, who pays for hospice care? That's a biggie.
Financial concerns can be a major burden for many patients and families facing a terminal illness. Hospice care is covered under Medicare, Medicaid, TRICARE, and most private insurance plans.
All righty, so that's another question that I'm asked. A lot of people say, how are we going to afford it? But these plans, Medicare,
Medicaid, TRICARE, and most private insurance.
Great. Next slide, please.
What does hospice cover? They cover the nursing care, medical equipment such as their wheelchairs, canes, walkers, medical supplies such as their bandages, catheters, drugs for symptom control, and pain related to the terminal illness. It's related to the terminal illness. Short-term care, including respite and inpatient care for pain and symptom management. Hospice aid and homemaker services, social work services, dietary counseling, grief support to help you and your family.
That's pretty much self-explanatory, but there's a number of things I want to talk about. A biggie with me is respite care. That hospice does allow many of the caregivers to have respite.
Yes.
Could you explain to our viewing audience about
respite?
Yes,
respite care is really care for a break for the family members.
Caregiver, right.
For the caregiver can be able to send their loved ones to a facility that we are contracted with for up to 5 days, every 30 days. And that helps not only the patient, but helps the family member to be able to go on vacations, to be able to run errands or have a break so they won't have that caregiver burnout.
Yeah, and as you very well know, there's a lot of caregiver burnout.
Yes.
And respite care is extremely important. For individuals who are not receiving hospice services, I see that so many times in the community when I walk the street and I knock on the door and there is a caregiver. I can see it in their faces. I can see that they are beat. primarily because a lot of them don't have the technical expertise and education to really care for the loved ones. And then it's like any other thing. When you work on a job, you have vacation time. It is the exact same thing when you're caring for a loved one. Under hospice care, a person can have respite, and that's extremely important. The other thing that, Annie, that I'd like to talk about is you mentioned medication and things of that nature for pain for the person. The big thing with hospice care, it allows a patient who may be experiencing a lot of pain to be comfortable and have a higher quality of life.
Correct.
Okay, Queen, we go to the next slide. The right to ask their physicians for a hospice referral, the right to choose which hospice they prefer to provide their care,
the right to transfer to another hospice if they're not satisfied with their current hospice care, the right to see their primary care physician while on hospice. A lot of families think that once they come on hospice service that we have to stop seeing our primary care physician.
Right, that's a big thing, Annie, and I'm glad that you're covering. Would you clarify that?
Yes, you still can see your primary care physician because you have been seeing this physician for the last 20 years. It would not be right for you to stop seeing your primary care physician. The primary physician just need to be educated on not to use the same diagnosis that we have the patient on service for, and they can continue to see their primary care physician. And we recommend that, and we encourage that to our patients.
And I'm glad that you covered that because that's an extremely important thing because a lot of people, they don't want to give up, and rightfully so. Why would they want to give up someone that they have a relationship with?
Absolutely.
But and it's huge. And what is so beautiful about hospice care is that it is seamless with the care that you're. That's the easiest way, Annie, I guess I can say it, is that when hospice comes in, it's seamless. There's really no change except the quality of care for the patient is improved.
Absolutely. And not only that, we're just that extra set of eyes and ears for the physician. So
Exactly.
that's good communication for us to work together as a team for that patient.
That's it. Next slide, please. Biggie here, bereavement support.
Yes. There is continued commitment to bereavement service for both family members of hospice patients and for the community at large. For a minimum of 2 years following their loved one's death, grieving families of hospice patients can access bereavement education and support from the Glory Hospice and Palliative Care team.
That's awesome. 2 years.
2 years.
After the expiration of their loved ones.
Yes.
Now, and this is something that's just huge because, you know, people grieve, everyone grieves differently. There is no blueprint for grieving. And the one thing that I try to stress in the community is that you grieve at your own speed.
Yes.
Don't let anyone try to tell you, oh, you've got this, it's time for you to, you grieve at your own speed, at your own time, for your own healing. So would you repeat this again? I love this about hospice, that it's not about it's about the holistically, about the whole family.
Yes.
Just as much caring for the patient as it is for the family. So would you repeat that last thing, that for 2 years?
For a minimum of 2 years following their loved one's death, grieving families of hospice patients can access bereavement education and support from the Glory Hospice and Palliative Care team.
And I think that's awesome.
Thank you.
I really do. And what I would like to, and I will speak to Kevin about it, is having 2 other individuals from your care team, which would be the bereavement counselor and the chaplain.
Wonderful.
To come. Next slide, please. Volunteering.
Yes, volunteering makes you feel needed. Volunteering can lead to learning new skills. Volunteering can help you deal with some of your personal problems. Volunteering can also help you meet new people and breaks down barriers of misunderstanding, mistrust, and fear. If you're interested in volunteering your time or you have a skill that you would love to share with us, please contact us at 706-507-5445.
And you want to know something? And there's nothing like volunteering. And I know that every hospice, you've got to have people to volunteer.
Yes.
Because you provide such comprehensive services that you need to have people volunteer. Would you repeat that number again? Because it's important, and it does make people feel good when you actually give of yourself to something that's
Yes.
worthwhile and not just always receiving something. So will you give that number again, please?
The number is 706-507-5445.
Okay, we're at the end of this delightful program, and we're dealing with Glory Hospice, and I'm going to ask you, Annie, to look into that camera again and just let everyone know how to contact Glory Hospice. Give all the contact information. I'm going to have you give it twice.
That's again Glory Hospice and Palliative Care. We're at 122 Enterprise Court, Suite D, as in David, Columbus, Georgia 31904. Our phone number is 706-507-5445, and our website is www.gloryhpc, that's henrypaulcarl.com. Again, that's Glory Hospice and Palliative Care, 122 Enterprise Court, Suite D, as in David, Columbus, Georgia 31904. Our phone number is 706-507-5445. And our web address is www.gloryhpc.com.
Well, Andy, I just want to tell you it's been a pleasure having you and having Kevin here.
Thank you for having us
Only
on.
thing I'm mad about I wish I had that shirt Kevin had on. Boy, just
Nice and
jump-
yellow. Speak volume, doesn't it?
Oh, it does. It looks so good, too. I'm telling you.
Yes.
I appreciate you. Appreciate what all y'all are doing in the community, providing hospice care.
Thank you.
And to our viewing audience, this is another segment of Focus on Health. Love coming and bringing information like this here to you in the community. Until next time, God bless you.
God bless you.